Dissociative Identity Disorder, commonly known as DID. What is this mental illness? How is it caused? Countless cases of this personality disorder have been reported in which the individual is said to display various distinct characteristics at any given moment. The diagnosis of dissociative personality disorder is controversial. Does this illness truly exist, or is it the result of one's imagination? According to the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, known as the DSM, patients who suffer from this mental illness are categorized as displaying at least two or more distinct personality states, where each interacts with the environment in a unique way. Patients who suffer from this mental disorder typically exhibit advanced memory loss of self-identification, frequent headaches, selective memory recall, depression, and phobias, yet the controversial aspect of this illness is how it originates. Researchers have discovered that patients who suffer from DID interestingly have one commonality. They were subject to traumatic experiences during their childhood. Some patients underwent physical abuse, sexual or emotional abuse, neglect, or even witnessed a traumatizing event, and these situations were enough to trigger the development of a lasting personality disorder. Nowadays, doctors and psychiatrists debate whether this illness is valid. In addition, not all children who have experienced trauma develop this disorder, so why do the minds of an unlucky few subconsciously create an alternate ego? The understanding of DID was further developed during the late 1950s, when a movie, The Three Faces of Eve, was produced, based on the life of Chris Sizemore, a woman who suffered from three main alternate personalities, 22 in total. When interviewed, Sizemore explained her past, recalling back to the traumatic events of her childhood into her adult years, each day struggling with her personal identity. As a 2-year-old, Sizemore witnessed many startling atrocities: the horrifying accidental death of 2 men and her own mother sliced on glass shards. It was these traumatic experiences that caused Sizemore to create alternate egos. As a child, she began to associate everything she saw with death, but her separate personalities allowed her to escape her memories, to suppress the past and mentally block out the trauma. She described herself as able to see a personality leave her body while she physically acted, but mentally and emotionally someone else was acting in her place. After years of therapy and treatment, Chris Sizemore has finally gained leisure from her 22 alter egos, and she understands the identities are integrated into her one being. As an old woman, she no longer expresses multiple mannerisms, flashbacks, or memory selection, but she will always live with her disorder. The neurological aspects of dissociative identity disorder are still under question today. Through brain imaging, it has been noted that the electrical chemical activity in the brain is altered during different personalities. Although doctors believe that patients who suffer from DID typically do not display an abnormally sized hippocampus or amygdala, these parts of the brain are responsible for long-term memory storage, disorientation, and emotion. Epilepsy, which is common in DID patients, can be localized to the temporal lobe of the brain that houses the hippocampus, an area specialized in the formation of memory. Although it has not been formally accepted, it has been hypothesized that the corpus callosum between two hemispheres is not entirely intact in patients with DID, and the right hemisphere, which specializes in visual imaging and emotion, seems to be highly activated. Equally important, neurotransmitters that are involved with emotion and response, such as norepinephrine, opiates, and serotonin, have been found in an increased abundance in the brain. Due to the rarity of this disease, little research has been conducted on this disorder, and to this day little is known about the causes of DID. Unfortunately, those who suffer from this mental illness will continue to struggle with their identity until more in-depth research is conducted.